Hey Barbara, a few things, maybe once you get some of your toys, the balls are going to go underneath the hip joints. So find your bony landmark of the front of the hip joints or the pelvis, come into soft tissue and just down to the groin area. And that's where you're going to rest on the balls. So this can be, of course, included when you're doing some of your time just laying on your stomach. And the idea here is, again, just allowing your body and the thought of maybe the hip flexors, the hip joint, just to really melt onto the balls and over the balls. I would say you can stay there for a good minute and a half to even 3 minutes. Lots of good breathing. Do note that if you find that you're feeling a pulse underneath the ball, you may just want to adjust it, move it up, down, or in or out a little bit, just so you're off of that femoral artery. So with these guys, you'll then flip over, place the balls underneath, pretty much, I say maybe just right underneath the pelvis, but what I did is the sacrum, that last part of the spine, I went out on either side to find soft tissue. And so the balls are resting pretty midway between my pelvis, not under the lumbar, not under the tailbone, but right in the center. Allow your pelvis to really rest and land. Legs remaining just as kind of your stabilizers, pretty quiet. You can move into your 12 o'clock and 6 o'clock on your clock face. When you do this, note as I roll back to 12 o'clock, I want to feel my abdominal wall kind of drop down, not a gripping or a popping up. You want to let it kind of sink down. The idea is to try to work deeper versus more superficial. After maybe about 10 rocks, settle and land. And then we talked a little bit about some imagery. And first, the image of the heads of the femurs, which again kind of lie right at about the level of the groin, right inside your hip markers. Think of those bones sinking down to make contact with the ball. So just allowing that image. And then I feel like the image for you that worked was, imagine a string that or cord that attaches at the knee and runs parallel to your body, lifting one leg and lowering, and then again lifting the other leg and lowering. Try to keep the pelvis pretty steady. You're going to repeat that, Barbara, a good maybe 8 to 12 times. Thank you.